My name is Gretchen Battle, and I've been in the health and wellness space probably for the past 15 years. I have a National Board of Wellness certificate. I went to Howard University for my undergrad. I graduated from one of my master's.
Hi, my name is Rochelle Osgar. I'm a health and wellness coach. I specialize in helping people move forward to knowing what they should do and actually doing it, really taking out that shame, pressure, or burnout.
Hi, I'm Rezsnyak. I'm a board certified health and wellness coach. My journey really starts with exercise science. So I have a bachelor's in biomechanics and exercise physiology. And then I became a board certified coach in 2021.
I grew up with my mom doing motivational teaching, and I really started to realize that people don't need more advice. They already know what they should be doing. What they really need is support that helps them follow through without that guilt or pressure. And wellness coaching meets people where they are and allows them to do that. It's collaborative, non-judgmental, and focused on progress and not perfection.
My mom was diagnosed with cancer in 2011. I had graduated from college and I was in between what was next for me, what direction I was going. So it was a really pivotal time that changed not only the dynamic in my family, my mom's health, but the direction I took. There was a huge gap in her health and what that translated into her moving through her wellness journey, just navigating the emotional side of healing. I realized I wanted to help people in between appointments, work alongside them, help them make sense of their healing journey.
I actually have my master's in public health and really liked public health and what that stood for, because it was all this stuff outside of medicine that wasn't the clinical side. My first real big girl job was a health educator for seniors. And I really liked that role and figuring out how to better communicate wellness for people in a way that makes sense. And since then, all my jobs really have just fallen into this cool wellness category.
Wellness coaching is collaborative. It's centered and focused on the individual and what's going on in their dynamic. We're not fixing, we're not directing, we're not diagnosing, we're partnering with them to really build self-awareness and build skills. And through that, we're helping them learn how to create sustainable behavior change.
What wellness coaching really means to me is focusing on the whole person, not just on one area, but really looking at, depending upon who you speak to, there's either 8 areas of wellness, there's either 6, 12, it just depends. But however you wanted to define it is making sure that all of those are as aligned as possible.
A supportive partnership. It's about helping people get clear on what matters to them, how supporting them is going to best help them take those small steps to realistic steps forward. It's not about being told what to do. It's about having someone in your corner to help you figure out what's going to work for you. The biggest misconception I would say about wellness coaching is that it's a hype. It's just motivational talk.
That we can tell you what to do. That is probably the biggest misconception.
Coaches are just there to tell you what to do.
That as a coach, you're telling someone what to do. They're coming to you to tell them how to do it, give them a blueprint, or from their perspective, this is how it should be done. And that's really not it at all.
Coaching is really about partnership and aligning and helping you to get to where you need to be, not me telling you what to do, because if not, you're not going to do it. So
good wellness coaching is structured, thoughtful, and rooted in behavior change, and it's there to build skills and not just hand out advice.
Therapy and counseling really focuses on the why we do the things that we do from a root cause lens.
Those two focus on diagnosing, treating, and managing mental health conditions, whereas wellness coaching doesn't diagnose or treat.
Psychiatry will focus on the diagnosis, the treatment, the mental health condition of the individual and what they're currently experiencing, and have a care plan. The wellness coach is really helping the individual apply that care plan. And really it's future oriented and action based.
Coaching really is going to focus on the what's next. It's all about the partnership. It's all about walking through this journey together. And as a coach, my role really is just to walk beside you and a little bit behind you, asking you some of those probing questions, listening, helping you to be held accountable.
It's future focused and action oriented, and it works best alongside therapy, but not instead of it. I support Muud's wellness training program through coaching, education, and program development. The program is designed to train the core competencies of coaching, including communication skills, behavior change, ethics, scope of practice, and client-centered support. It really helps coaches to prepare themselves for the NBHWC board certified health and wellness coach exam.
Within the Muud's Wellness Coach Training Program, I am the assessment coordinator. I support the development of future coaches.
I am the faculty lead. We're all going to figure out what that looks like as we're building the ship together. But the one big thing about our training program is that it's really focusing on mental well-being and kind of having that mental playbook for yourself and understanding how your mental health affects all the other areas within your life and how to make sure that you're self-regulating, how you're making sure to slow down, how to breathe, and then all the other necessary things to make sure that we are aligning with the National Board of Health and Wellness.
You gain supervision, practice hours, and through that, you're able to apply for the National Board exam and then take the exam if you meet those requirements. What makes Muud unique is that the coaches aren't just learning the theory, they're trained inside the integrated care model from the beginning. So coaches receive real coaching practice, high quality feedback, and exposure to how wellness coaching functions inside of an integrative care model. So working with other practitioners.
The fun part about it is that it'll be definitely hands-on. All three of us are really well-versed coaches in a variety of different areas and different modalities, and definitely have come from different lenses of coaching. Students will definitely be able to ask questions on like, what does it look like coaching in this market versus this market?
Muud emphasizes really self-awareness, regulation, and presence. Graduates are not just going to be certified, but they're ready to really support real humans in complex situations.
A couple of different things. One of my favorite colors is purple. So anything purple kind of drives me there. I was like, ooh, it really aligned with my personal values and everything that it stands for. I'm a really big person on access to care. I think universal access is something that the medical community lacks, and also health literacy. But the fact that that's one of the big things that Muud really promotes is making sure that there is access to mental health care and just healthcare in general.
The big focus for Muud is ethics, boundaries, and doing this work responsibly. It treats wellness coaching as a real profession that it is and not a trend. We've been seeing a lot of that in social media and all over the place right now, and it's just nice to know that they really do prioritize those standards.
Their paradigm, their pillars, their emphasis on connection, integrative care, using modern technology to expand this without losing that human element.
And I love that Muud is invested in supporting coaches and just as supportive in supporting its clients.